application of the moldable pouch in a few different ways. We're using the two-piece moldable system. So you want to gather your supplies first. Once the pouch is off, you want to make sure to clean the skin just with a wash rag with warm water, and then dry the area. You can skin prep the area using an all-care barrier wipe, especially if education is going to be done. Sometimes we change the pouch a little bit more frequently when their patient is here in the hospital. So you're going to take it and dab around the area. As that's drying, we're going to take our measuring guide and measure the size of the stoma. So it should be about 1/8 of an inch difference. So 1 1/4, probably this one 1 1/8 fits it pretty good with moldable. This would be an example of one too big. 7/8 would be an example of one too small. So according to the measuring guide, I'm going to use medium moldable. I take my flange or my skin barrier and I can kind of line it up and start molding it back. The idea is to mold and then hold it there. Then I'm going to use this see-through window to see how I'm doing. In some instances, we can snap on, if the patient's belly is tender, you can snap on the low pressure adapter. And then what you would do is snap on, put the wafer on, and then once the wafer's on, you could apply the pouch. Otherwise, another option is to snap the pouch and the wafer together ahead of time and put it on as a one piece. And you snap on like Tupperware. Double check, make sure it's on good. And what you're going to do is have the patient pull the blue tab, fold down the tape border, and then apply the pouch. The moldable system is designed to go up and fit snug around the stoma, so it should kind of hug it like a turtleneck. Once it's on, I'm going to slowly pull away the tape border, and as you're pulling it away, laying the tape border down. Then you want to make sure the end of the pouch is closed. Usually they come open. So it's a 1, 2, 3, and multiple presses. And then another option is to flip it over like that. The pouch theoretically could remain in place for 3 to 5 days. It needs to be emptied when it's 1/3 to 1/2 full of stool or gas. That is a demonstration of a basic pouch change.